Hi, I'm Dr. Blair Masters with Arkansas Physical Health and Rehab, and I wanted to talk today about something that some people tell us when they come in. They said, yeah, I went to the emergency room, they took x-rays, and they said there was nothing wrong, but I'm still hurting, so I wanted to get checked out somewhere else and see if they could find anything. Well, this happens on a regular basis, and part of the reason this happens is most injuries don't show up on x-ray. There's lots of things on the x-ray that you can't see in normal x-rays. They're still there, you just can't see them. They kind of look like shadows or that sort of thing. There's what's called the joint capsule, which is a ligament around the joints, particularly in the neck area is what we're looking at. The nerves, the spinal cord, you can't see these on the x-ray. The ligaments, the discs, all the muscles and that sort of thing. So you can have very, very significant injuries and they don't show up on your standard x-rays. Now, this is one of the reasons why we at Arkansas Physical Health and Rehab take a number of x-rays that oftentimes they don't take in the emergency rooms, so we can be more thorough and make sure that we find the problems that you're suffering from. We take your standard front and side view that they do in most emergency rooms, but we also take one where you're extending, and this shows oftentimes ligament problems. It sometimes shows joint problems, joint capsule or the ligament around the joint, problems with that as well. That can show a lot of issues. We take some where you're flexing forward. This we focus on ligaments primarily with that particular picture, and then we also take two of them where you're bending sideways to see how you're moving. And when you bend sideways, a very particular kind of motion should occur called coupled motion. This is a biomechanical process that is widely known in medical circles, but oftentimes the ER doctors don't bother taking this kind of x-ray. They oftentimes don't know how to read it, and this is why many people come to us suffering, not knowing why. We take these x-rays and then find, yeah, there's the issue right there. And then we know exactly how to take care of that. We have specific exercises that are designed to correct the problems that we find on the x-rays, and we take post x-rays to make sure they're corrected. If it's not corrected, we want to know that as well, because many people suffer from automobile accidents sometimes the rest of their lives afterwards. It accelerates your arthritis process in your body. It makes disc degeneration more likely. So if you've been in an automobile accident, call our office and come in and be sure that you get checked out with these special kind of x-rays that we use in automobile accidents.